The Macon Volunteer Clinic is basically designed to serve the working poor.
What this program does is to help the people who are working people, who have an income, but due to the high cost of insurance and the high cost of physicians and the high cost of drugs, they literally, for all practical purposes, have little or no medical care. They just simply can't afford it.
Macon Volunteer Clinic program addresses a fairly unique population that is missed frequently by federal and state programs that focus primarily on children and pregnant women.
The working uninsured are people who work in jobs which we see every day. They're white, they're black, they're Hispanic, and they're across our city. They're in your neighborhood. They're in my neighborhood. In fact, they're probably in your family. Many grown kids get to an age when they no longer qualify for their parents' insurance. There are many, many college kids who are working their own way through school and have no health care coverage.
Part of the reason these people don't get care is you give them a prescription that's going to cost $80. They go to the drugstore and it says, this will be $80. And they say, well, gosh, I can't afford that. And they walk out with no treatment.
They don't even think twice to go to a doctor. They use home remedies to try to fix their problem. And instead of it being a help, a lot of times it's a hindrance. It doesn't help the situation, it prolongs the sickness.
When I began to look into the idea of a clinic, I went and talked to Ann Jobe, the dean of the medical school, and she was extremely excited about the idea. Then I came upon Shannon Harvey, who's working on Healthcare Central Georgia, and she reported to me that there are about 26,000 people in Bibb County whose income is under 240% of the poverty level and have no health care. This is about 1 out of every 6 people walking down the streets in Bibb County. And as you look into it and you find out that Bibb County has some of the best health care in the country, you say, why do we have so many people in this category? And the more research you do, you discover this is a nationwide problem. 65% of the businesses in Bibb County have no health care for their employees. And this number is growing because, as everyone knows, the cost of health care, particularly in small companies, is almost prohibitive. So people who are unemployed are on welfare and get Medicaid, but if they try to improve their lives and go to work, they lose their insurance. These people are hardworking, good folks who are caught in a system, and they need help.
To make sure that we're hitting the people that we want, getting the people we want in our population, we've developed a screening process. We feel it's important to have eligibility standards because we will have limited resources with which to conduct this project, and we need to make sure that we are serving the people that we intend to serve and not people that do have other options for care.
We have a huge need, and we have a huge resource in all these people. We also have a large number of retired physicians in Bibb County, and many of them have come forward saying they would love to work.
When I graduated from medical school at Tulane, the professor who gave the commencement address said to us, in essence, this. He said, in just a few moments, when you are handed this medical diploma, you will be a doctor. And you will have all the privileges and rights and respect that the medical profession has. And you do not deserve any of that because you have not earned it. It has been earned by decades and generations of physicians who have done what the medical profession is supposed to do, and that is take care of the medical needs of the people. And he says, you be sure when your time comes down to lay the reputation you have had, that it be just as good as when you inherited it. What we're trying to do is to get a physician to commit himself to spend 3 or 4 hours once a month. I have been astounded, absolutely astounded, at the outpouring of interest by so many segments of the community.
I think that brings it home. What being a physician is all about. We need to help people, and what better way to give of yourself to help somebody and not expect anything in return.
There's a lot of opportunity for a person interested in helping with our clinic, and you don't have to be a medical person to do that.
It gives everybody an opportunity to do what they love best, and that is to work with others. We do love to work with each other if given the chance. We would love to show off our different talents and our different capabilities if given the opportunity.
We've had enormous support for the clinic from the business community. We can't improve the business community if our working people are not healthy. We've had a good many unsolicited gifts of cash and gifts in kind. We have received great support from some of the foundations in the community.
In an effort like this, we've sort of had to look at the reasons that we wanted to be in medicine, and I think that includes doctors and nurses and dentists, but it also includes healthcare executives, these people who run the hospital systems in town. We feel like we've seen everybody's best side. It's recognized among the people in healthcare in Macon that there is a subset of our population that doesn't get the appropriate care, and we all need to be about eradicating that problem.
As we have moved forward with our clinic, we have had enormous support and help from people like Don Falk, the head of the medical center, Mike Boggs, the head of Coliseum.
This property on Ingleside came available, or on Rogers Avenue, right in Ingleside Village. It's an area that people around Macon know as a shopping area. This effort needs to be big enough for anybody who works yet can't afford private insurance, who can't afford to get private care. The Anderson Health Center has been there for years, which is the alternative for most of these people, and has done a tremendous job fulfilling the needs of the community with both primary care, general internal medicine and OBGYN, and also specialty care, neurology clinics, orthopedic clinics. And it has been broadly supported by the practitioners in this town who attend those clinics and supervise those trainees, those physicians in training.
We aren't here to try to replace the medical center's clinic work. We just only want to supplement it.
We will also be working very closely with the medical center on making sure that people who are eligible for their programs have a smooth transition. Our goal is to keep people healthy. We would like to find somebody's high blood pressure problem before it becomes a serious heart disease. We'd like to know and find somebody who's a diabetic or pre-diabetic state and intervene so that they can learn how to take care of themselves so that they can be healthy and continue to work and not wind up in the emergency room in a diabetic coma or with a heart attack.
This clinic will require an ongoing fundraising responsibility. We plan to endow this clinic.
We're tapping into the altruism that seems to be the attractant that brings a lot of people into medicine.
This is a community-wide effort.
It's just now is Macon's time.
And I think if we're going to succeed in anything, we have to do it together.
We are our brother's keepers. We are not well off if a large segment of our community is in trouble. It's just important to be able to keep people healthy. When they're healthy, they're happy, they're productive, they're positive factors in the community. In a few weeks, I'll be 72 years old. And, as you get older, you kind of reminisce a lot, and you look back, as you know forward isn't going to be as long as what back was. And when I look back, the things that have really given me the greatest satisfaction, in fact, all of the things that have given me the greatest satisfaction have nothing to do with the amount of money I've made. And I don't think I'm unique. I think that's the norm for most people, especially in the medical profession. And I think when more people have a chance to be in a circumstance like this clinic will provide, more medical people, it will give their whole life experience a greater sense of satisfaction.